So my name's Tobias Wolf. I'm the Gender Identity Welfare Rep at the university. So my job is looking after trans and non-binary individuals, making sure that the university best represents, supports and aids those students so they can get not only the best experience at university but also the best grades in future.
I'm Taylor. And my role at the university, I am the LGBT+ chair, which basically just means that I kind of oversee elements and see where things need help where. So mine is kind of an overbroad, so I look at all elements of the LGBT+ network kind of thing, community.
Thank you.
It's a bit of a double-edged coin. Sometimes you can have really great fun, like when you go to LGBT plus friendly events, like for example the Prides or any events that we hold down here. But at the same time, it can be very unsettling because it's not the most open and liberal area. It can be very awkward. The staff at the university, while being friendly, a lot of them don't know about non-binary identities or anything other than gay or lesbian. So for both myself and a lot of my friends who I know, they've had the experience of having their identities erased, which one time isn't too draining, but when it's the 50 times a week, it gets very draining and you can start kind of going back into your shell rather than coming out of your shell, which is what university is all about.
Yeah.
I'd also add that it's a bit of a weird experience because being students, it's also that we have to teach people a lot of the time. So it's kind of you come to university to learn, but then you're having to teach people about your identity to respect you and stuff, which I think is, like I said, okay like the first time and even the second time, but then you get to the point where, I just want to go to my lecture and have the right pronouns without having to explain anything.
Yeah, I'd say that the lack of, especially in the trans, non-binary and intersex sort of areas, a lack of knowledge and understanding even among lecturers is quite shocking, because we've actually had to do the teaching in the class. By the way, intersex is a thing. By the way, non-binary is a thing. It's not a recent trend. Look at all these different cultures that have never been connected, that have non-binary going back absolute years. Since I got involved in 2014, we've come in leaps and bounds. But we've very much got a core family group, and like you said, we've got loads of different people identifying differently, but one of the key parts of the group is the fact that we help teach each other. So a lot of people will be like, I don't know what I am, I'm just questioning. And by the time they've been here for, say, 6 months, they'll be like, I know my identity, and not only do I feel empowered by it, I also feel relief that I'm not broken. For example, with asexuals, it's not just that I don't lack a sex drive and that's wrong. It's I now know I'm not the only person on the planet.
Also from that is that we've had people who may have come out in the past and then not been accepted, so been a bit nervous about coming out again, but then managed to come out and go, actually now I feel safer and I can explore my identity properly, rather than when they've done it in the past, they've explored their identity and it's been so shunned or so ignored that they've had to kind of even go back to the closet, which...
Yeah. Mostly I've experienced many microaggressions, more erasures. So the assumption that I am male constantly, when I correct, the instant okay, so you're they, them. Okay, cool. So anyway, he, and it's like, no.
Frustrating.
I mean, there are a few times I've had small comments made where I'm like, you were talking about my group, but most of the time, because I'm there to get seen, I kind of don't feel able to challenge at that point, because I'm the patient and I want the best care, so it's harder to challenge. Whereas if, for example, I'm with someone, I'm a lot more in a position where I could challenge, because I'm not having to ask for help.
Yeah.
Most of my negative experiences with the healthcare actually come from having to go there and support other people who have had issues, and challenge those people.
My main problem with healthcare has been the fact that my preferred name and my legal name are different, and having to constantly say whether it's physical health, mental health, having to say, this is my name, but yes, there is a legal name as well, and I have to say both, and it's kind of every single time, even if it's like, because I go quite regularly to Greenfields, which is a mental health support place, and even though I'm down as Taylor, I still have to double check every time. I can't just say Taylor, because then they might go, oh, but we don't have you here, because it's not a guaranteed. It seems to be. It seems to be a hit and miss.
So it's a bit of a lottery then.
Yeah. So every time I ring up any kind of healthcare profession of any kind, I have to say both names, because I don't know which one they'll have me under. Even if I have made it clear that I use Taylor, I will still have to say both names just in case, because they may go, oh, we've got this name, so I find it easier to say it myself than to have someone else say it.
It's not a deliberate action, but it can be very belittling, and it can make the person it can turn their day upside down. And after so many times when you come to accept it, that's a bad thing, because you almost just dig into your own shell, and I've seen a lot of people stop challenging it, or stop mentioning it and go into that shell, whereas the one thing we don't want is for people to feel like they've got to hide their own identity, especially when it comes to, obviously medical care physically is important, but especially when it's coming to mental health, whereas the one thing you don't want to do is be regressing in your mental health.
Yes.
I think that's part of the reason why the network is so important for us, because
as
a community we're outnumbered, and we certainly have only just started to scratch our rights. I know that obviously equal marriage is now a thing, and we are definitely going towards progress, but there are so many smaller areas to knock off, and while when we say smaller area it doesn't sound as bad, you realise that if you add all the small little things that we need to achieve together, it's more than we've achieved in the first place. And it can be very overwhelming as an LGBT plus person when you realise, oh, doctors, that's a place that's dangerous. Oh, well, like I've mentioned previously, I do think that it's very important that the ones in training now get a huge amount of information as part of the curriculum to understand these patients that they're going to be dealing with. But obviously, while that's great for the future, that doesn't deal with the problem of what about the patients for the next 10 years before these people are in those positions. So I think it's very important that we go around educating as many members of staff as possible, even if it's a terrible loss and we only hit 1 in 10, that means that that person is still going to make an impact positively with LGBT+. So even worst case scenario of 1 in 10, we make a great impact, especially with healthcare. People are going into, especially NHS healthcare, to help people. So they're good-willed people, it's just they've got to have the information to be able to do something about it. That very much is a great thing. The visual sight of it is going to calm a lot of people down. It calms me down when I see some kind of LGBT plus symbolism in the SU or anywhere. So when it comes to your healthcare, that's even more appropriate to have that patient relaxed and most comfortable.
That's good.
I think even if you're not actually seeing the person who is wearing the rainbow lanyard or anything, it does make you feel slightly better, because you go, okay, someone here will understand. So if your doctor is struggling, you have someone else who may know what you're going through, or may know what in that situation to go to.
Yeah, so when I first tried to get my referral to a GIC, my doctor didn't know how to do it. And I had to wait for him to find another doctor who did. But with stuff like the training and the rainbow lanyards and badges, if that doctor had a colleague, he could have gone, oh, I know exactly who to talk to about this. It's a lot less stressful, it's a lot less time consuming. So it doesn't fix all the problems, but it's a shortcut to a lot of fixes. And like you said, if you know someone else is trained, you're going to feel a lot more relaxed because
Yeah.
you can just go, oh, well, what about the rainbow? Well, I think it's important that we talk openly about not only trans and non-binary individuals who will have female anatomy of the cervix, but also the fact that intersex people might be missed out of this, and the actual acknowledgement that these people exist. It's not just cis women who have these problems, but I think by openly acknowledging that these are risks, it makes it easier for those in the trans, non-binary and intersex community to come forward for these tests, because it's one of the scariest things is I have to out myself, and not only do I have to out myself, but in such a personal, invasive way.
Yeah.
And I think it also works the same way for people who are at risk of prostate cancer. It's very, very invasive.
Yeah.
And so to be more open about it in the public will mean it's easier for people to approach. It doesn't fix the problem, but it makes it easier, which will reduce the numbers while we come up.
It's kind of normalising it a bit, because I think when people go, oh, it's rare or something, it's like, no, it can happen to anyone. It's not just a small percentage.
Yeah, I think one of the problems with cancer especially is the fact that there's a huge amount of confusion and misunderstandings about it. So like some people think, oh, it's only if you smoke you'll get cancer. It's like, no. You're at risk of cancer if you were never around a smoker. And it's important to note that, like, look into that. Certain medication for, I think, for example, can increase your chances. And stuff like that. So it's important to break open a lot of the misconceptions that are around cancer and being LGBT plus and having cancer or being at risk of cancer.
And I think for you.
So we've basically just helped out with the trans and non-binary areas, giving our knowledge that we've accumulated, showing areas that, you know, everywhere there's blind spots, and so basically we're just helping point out a few of those. It's been a real privilege to work with you, but I think one of the best parts about it has been the fact that we've been able to see the positive impact that it's had, especially when we get to tell our membership, look out for the rainbow lanyards, look out for these symbols. These are trained people. We know that this training is positive, especially for the trans community, but not just for the trans community. I know it does go into more. And you see the members relax visibly because they're like, I know I can go to this place. I know if I see this, because they trust us, and through that they trust the training that has been delivered. And I think something like that can spread and spread and spread.
Yeah, brilliant, thank you. And Taylor?
From my own experience, it's just been great to see the changes that have actually taken place and be able to go, no, I know it's not me going, oh, I heard that this was happening. It's actually going, yes, no, I was part of the training, and I could see how the people who were in the training reacted, and from our own experience, they reacted well. And thought, actually, I didn't know that, or oh, I'll change how I do that. So, and it's been nice to be able to go, okay, so it's not, oh, we'll do something eventually, or with little things behind the scenes. You can actually see the changes.
And I think it did a lot for me personally to restore my faith in a lot of healthcare, because I was quite distanced because of negative experiences of myself and my friends, and then to work with these people who I had come used to butting heads with over these issues, and for them to say, oh, I really didn't know, thank you for educating us, was a very empowering and supportive sort of feeling, because I now know that if those people can feel like that, how many others feel like that, and I feel much more comfortable.
Yeah. So thanks Tobias and Taylor, and thank you for all your support with the project over the last 2 years. We really appreciated it.
That's okay. Thank you very much for letting us be involved. It's been wonderful.
Yeah, hopefully be able to work with you again on other projects and things like that.
Thank you.